Where do DEXA scans measure bone density? Imagine a quick, painless test that can tell you how strong your bones are. That's what a DEXA scan does. It uses very low doses of X-ray energy to measure bone mineral density. But where exactly does it look? The main sites are the lower spine, specifically the lumbar vertebrae, and both hips, known as the proximal femur bones. These areas are chosen because they are large bones that tend to show changes in bone density earlier than other parts. This makes them the best spots for diagnosing osteoporosis and predicting fracture risk. During the scan, you lie comfortably on a padded table. A scanning arm gently passes over your lower back and hips, emitting a small amount of X-ray energy. The machine measures how much of the X-ray passes through your bones, which helps determine how dense your bones are. The lumbar spine and hips are preferred because they provide the most relevant information for your bone health. These sites are sensitive to changes in bone density, especially in the early stages of osteoporosis. Sometimes, if the central sites cannot be measured, for example, if you have metal implants or other issues, the scan might include the forearm. Peripheral devices, which are smaller and portable, can also measure bone density at the wrist, fingers, or heel. However, these peripheral measurements are less accurate for predicting fracture risk compared to the central sites of the spine and hips. The reason these locations are so important is because they are common sites for osteoporotic fractures. Detecting bone loss early at these sites helps doctors decide on treatment options and monitor how well treatments are working. It is worth noting that peripheral measurements can be useful for initial screening, but a full assessment usually involves central scans for a more complete picture. In summary, DEXA scans primarily measure bone density in the lower spine and hips. Occasionally, they include the forearm if needed. This approach follows established medical guidelines to give the most accurate and useful information about your bone strength and fracture risk. Always remember to consult with your healthcare provider for personalized advice and interpretation of your results.